realize is that, inhalation is probably the most important route of exposure of this virus.
While evidence for airborne transmission has been building up over the last few weeks, Alberta Health Services still points to contact as the way that COVID spreads. That means that doctors and nurses might not be grabbing the kind of mask that will actually protect them.
Given the updates we've seen from the CDC and the World Health Organization, those updates are very clearly talking about an inhalation risk occurring both in close proximity and across longer distances when ventilation is poor, for example. I think given those updates, I would like to see a reevaluation of the stance from AHS.
While nurses and doctors have access to fitted N95 respirators at work, AHS recommends using surgical masks unless performing a specific procedure and leaves the choice to grab a respirator for daily work up to each healthcare worker to assess. One frontline worker we spoke to who did not want to be identified says that they don't often see N95s being used in their hospital.
Many just sort of typical patient activities, even just simply talking, breathing, speaking, shouting, coughing especially, those sorts of regular things that we don't associate with an actual, medical procedure, those are actually producing a lot of these aerosols. And if the patients are, infected with COVID-19 and if they're actively shedding virus, that can lead to everybody being exposed.
We asked AHS if they'd be updating their guidelines to recommend healthcare workers use respirators in light of the new data in recent weeks. They pointed us to an update from the beginning of March and said that as partners in the response to COVID-19, we trust our frontline healthcare teams to make appropriate decisions that support their physical and mental health. In Calgary, Joe Horwood, City News.